Well, good afternoon, everyone. I'd like to thank Donald Sanderson, CEO of West Prairie Sound Health Center, Dave Thompson, Director of Emergency and Protective Services and Fire Chief at Parry Sound, Frank May, who's Manager of EMS Parry Sound District Emergency Medical Services, Deborah Randall Wood, Chief Nursing Officer and Director of Patient and Family Centered Care at West Prairie Sound Health Center, Katie Hogue, Director of Primary Care Nurse Practitioner Lead at West Prairie Sound Health Center Rural Nurse Practitioner-led Clinic. And as well, I believe we also have Mayor of Parry Sound, Jamie McGarvey, and we have a number of other local mayors joining us as well to see today's announcement. So before the COVID-19 pandemic struck, the Ontario long-term care homes were operating at 99% occupancy with over 38,000 seniors on wait lists. Between 2015 and 2019, the wait list for a long-term care bed grew by more than 11,000. As of January, according to the Northeast LHIN, there were 130 seniors on the wait list for Belvedere Heights and 111 on the wait list for Lakeland Long-Term Care Home. The wait is too long for seniors and their families. I'm proud to be part of a government that is committed to modernizing and expanding our long-term care system. And I would like to take a moment to thank our long-term care home workers. They've done a great job of protecting our seniors from COVID here in the district of Parry Sound. But despite the great job they've done, the pandemic has highlighted that we need to do our part to help people safely remain in their homes for as long as possible. This is particularly true in communities like those in East Parry Sound, where seniors in these towns have to leave not only their homes, but their community in order to move into care. However, without the support they need, some seniors are at the risk of ending up in hospital or in crisis. One way to ensure seniors get that support is through traditional community paramedicine programs. Paramedics use their training and expertise to support the healthcare needs of community members. These programs have shown that 911 calls and hospital visits can be reduced. That's why our government has implemented a 100% provincially funded, long-term care focused community paramedicine program. We started with a pilot project in 5 regions. Then in November, Parry Sound was one of 29 regions invited to apply to participate in this program. I'm pleased to announce that we're expanding this program to Parry Sound District. Today, I can announce that Ontario is investing more than $2.9 million over the next 4 years in our area's existing community paramedicine program. Exact details of the funding for each year will be finalized next week, but this money will help provide additional and appropriate care for seniors in their own homes. This could include in-home testing and access to non-emergency support 24 hours a day, 7 days a week through remote monitoring. Dave Thompson, Frank May, Deborah Randall Wood, or Katie Hogue will be able to give more details about how they envision the program working here in Parry Sound. The bottom line is this program will help more seniors stay safe in the comfort of their own homes and in their community longer. These kinds of services will make a great difference in our area, particularly in those communities that are struggling to attract more doctors. And as Parry Sound is the lead community, I'd like to invite Parry Sound Mayor Jamie McGarvey to say a couple of words and introduce the people behind this successful application for funding. So Jamie, I'll pass it over to you if I may.
Okay, thank you, Norm. This is truly wonderful news. As the town of Parry Sound's the delivery agent for land ambulance services within the district. I know that you know, the community paramedicine that has been done in the past has worked really well here, and certainly we showed that it worked well. And I know that from my work with AMO, that AMO certainly supports this type of program, and every opportunity that we had to discuss this with the minister or the minister's staff, we did so. And I truly commend the government for doing this. I can see this really helping the seniors, and I would imagine when the vaccine rollout is we have the numbers for that we will be able to get into the homes of those seniors and make sure that they're vaccinated as well. So very important. Thank you very much for working on our behalf as well with the ministry to support this. And we appreciate the funding, and we'll put it to good use. And Dave Thompson, our Director of EMS Services, you're next, Dave.
Thanks.
Thank you, Mr. Mayor. On behalf of the Town of Parry Sound, the EMS Advisory Committee representing the entire district, thank you, Mr. Miller, and the provincial government for this funding. It will be put to good use throughout the entire district of Parry Sound. The town and the district is fortunate to have a strong relationship with West Parry Sound Health Center for the delivery of land ambulance and community paramedicine services throughout the district. The paramedic staff are exceptionally skilled, and they're very dedicated group of employees who will, through this program, be able to notably and positively impact the residents throughout the entire district. Additionally, the West Parry Sound Health Center is able to provide resources and expertise beyond the EMS staff for this initiative. It just further demonstrates the effectiveness of our partnership with the health center and how it can benefit the residents of the Parry Sound District in their everyday lives. Now, Parry Sound District has one of the eldest populations in the province. These funds will allow our paramedics to provide the attention and care required to keep our residents in the comfort and familiar aspects of their home, thus greatly increasing the quality of their life throughout the entire district. Thank you again, Mr. Miller, for this wonderful news. These funds will be put to great use in our area. Now I'd like to introduce Deborah Randall Wood from the Health Center to speak.
Thank you, Chief Thompson. The West Parry Sound Health Center functions not only as a place, but equally importantly as a center for our West Parry Sound health system, a system that works well beyond the walls of the hospital. We can do this, care for the many, many vulnerable people in our community by, of course, working with many community partners, but also by combining the skills of our acute care hospital, our primary care talents, and our 6 nurse practitioner-led clinics, and our exceptional EMS team, including community paramedicine. Before I pass this on to my colleagues to tell you more about that, I want to thank our MPP, Norm Miller, and his staff for arranging this important announcement that means so much to us in our community, and for always providing strong advocacy on behalf of healthcare services in the communities we're privileged to serve. I also want to pass along our thanks to the Minister of Long-Term Care, Minister Fullerton, and to Mayor Jamie McGarvey and Chief Dave Thompson. Your support and partnership in this operation of land ambulance across Parry Sound, it goes without saying we couldn't do this without you. I'm now happy to ask first Katie Hogue, the nurse practitioner, and our Director of Nursing, Clinical and Community Care, and then Frank May, our Manager of Emergency Medical Services, to describe this program that we're so excited about and the importance of this funding. Katie, over to you.
Thank you so much. I just wanted to thank everybody again for this opportunity, Mr. Miller and the town for the advocacy, for the great work that EMS are doing in the community support seniors and really all populations, everybody who requires healthcare. I've had the privilege to work with Frank and his team as a consulting nurse practitioner at the West Parry Sound Rural Nurse Practitioner-led Clinic, as well as with our addiction medicine program and at the COVID-19 Assessment Center. They've been absolutely instrumental in supporting remote monitoring for patients that have had COVID, but also for patients that require that additional support at home. This additional funding will just further support the work that they're doing. The nurse practitioner-led clinics have developed a system, as Deborah had mentioned, in the community to support primary care patients, but also patients that may not have a primary care provider, and in partnership with other community agencies. The rural community services 78%, we have 78% rural population in this area, and 68% of that rural population that we serve through the nurse practitioner-led clinics are seniors, and we're seeing that number grow as people are starting to retire and join our beautiful area, but will eventually need care. This funding will support those incredible systems in place to keep the people at home, to support primary care, to be able to deliver that care in their home in a system and a partnership. This will improve the quality of life for both the clients as well as the families and caregivers that are providing the care. That will keep people at home for longer, keep them out of hospital, but just improve the overall quality of living. I've had the privilege to continue my role as the consulting nurse practitioner, and I look forward to continue to do so as we work in a partnership in the system to keep people at home and healthy. I'm now going to introduce Frank to talk more about the program and the great work that his team is doing.
Hello, everybody. It's a great day for Parry Sound DMS. I'm excited to be here and part of this announcement. On behalf of our service, I'd like to thank Norm Miller for his strong advocacy for healthcare for services within the District of Parry Sound. Also to the Minister of Long-Term Care, Marilee Fullerton, for recognizing the importance that community paramedic programs can play in the delivery of healthcare, particularly in rural areas of the province. Mayor McGarvey, Chief Thompson, as well as all our municipalities that make up the District of Parry Sound, I'd like to thank you for your partnership and support in the operation and delivery of land ambulance service within the district. Katie, special thank you to you as our medical director for providing guidance and support to this program. You're a key player in the development of the program, and we appreciate all you do for us. It's my pleasure to lead 75 very dedicated men and women that make up Parry Sound District DMS. And we think traditionally of the job that we do as an emergency service. And community paramedicine is kind of the opposite of that. And community paramedicine programs have been around for around 10 years in the province. Our service has operated one for about 6 years now. And it complements our day-to-day operation very well. Part of the reason it works so well for us is because we have paramedics out in the district that are seeing people and realizing the supports that they're needed, and they're able to make referrals to this program and then ensure that those people are getting extra support that they need. The goal of the program for everybody in all services that operate them is to support seniors in their homes, seniors in vulnerable population, and in its infancy was to reduce the number of ER visits. And we've proven that that is a big part of this. But most importantly, it's to support those vulnerable populations, and particularly during times like we're in now. If we can bring programs and services to people's homes and they don't have to go out to get them, they're less apt to develop things like COVID-19. And that's one of the real bonuses of this program, is that we bring all of those things to the individual's homes. So I'm going to speak a little bit about our program and the people that make it. So we have base funding for 2 community paramedics, one on each side of the district. They work 40 hours a week, Monday to Friday, and this funding will allow us to expand that program to have 7 full-time people, as well as 1 part-time occupational therapist involved in supporting this program. It will allow us to deliver a program 7 days a week, 24 hours a day, which is a big enhancement from where we were only months ago. It's delivered through paramedics who are people that have worked in the emergency field. They're fully certified, trained, and qualified paramedics, and they've taken a change in their career path into something that is less emergency oriented and more about dealing directly with individuals. So they've moved away from the lights and sirens side of the business so much and into the community paramedic program. They have the base training as paramedics, and then they have other training that comes along to develop their skills as community paramedics. Our program has a number of key components that make it up and make it unique. And again, all of these programs are unique. One of the things that's unique as well about them is that we have the ability to take these highly skilled and qualified people, and when they're moving around our district and they're not tied up or booked on a community paramedic duty, and they're available to respond to an emergency, they're able to go to an emergency scene and stop the clock and begin providing care until an ambulance can come and transport the person to hospital. This also assists in keeping their skills so that they don't lose their skills that they've had for the emergency side of their work. So one of the key components is in-home visits. We receive referrals from our staff as well as from the LIN, from family health teams, family physicians, nurse practitioner-led clinics. And when we receive these referrals, we go into the home, we set up a time to meet with the person, And our first contact with that person, we do a complete assessment, vital signs. We check them out. We make sure that they're compliant with the medications that they've been prescribed. So we do a medication reconciliation to count and make sure that they're following them as prescribed. We inspect the home for any hazards, for trips and that sort of thing. And we look to see how well they're coping in their home and what services that we could potentially refer them to assist them with living a higher quality of life in their home. That's kind of the meat and potatoes of where the program starts. From there, we set a routine that we're going to visit them either weekly, monthly, or at least we're going to make phone calls weekly if they don't want to have us coming by the house. So that initial visits kind of tells us where we're going to go with the rest of the program. Another component in the program is wellness clinics. We do wellness clinics monthly in congregate living centers. And in these clinics, we have people come and they have a 15-minute appointment with a paramedic who assesses their vital signs, goes over their medical history, looks at their medications, does sort of a wellness check with them, and logs all of that information so that if they're going back to see their family physician, we can give them a record of that they can pass on to their doctor to say that they've had these vitals checked and this is kind of where they are with their health with that. This wellness clinics, particularly at this time and in-home visits, is also key importance because there's so much social isolation with this population, and having a paramedic sit down with them and have a visit for 15 minutes in a wellness clinic or an hour or two in their home goes a long way in preventing social isolation. We've talked a lot about remote monitoring, and remote monitoring is one of the key components of our program. In our remote monitoring program, we set the individual up with equipment in their home that monitors their vital signs. So we look at their oxygen levels, their heart rate, their blood pressure, their weight, their temperature, a number of different things. And we teach them to use those devices daily. That transfers the information wirelessly to our community paramedics who have set up a profile that's specific to each person. And they develop parameters for each of those specific devices. So if somebody takes their blood pressure and it's up by 20 points, it'll trigger an alarm that the community paramedic will make contact with them within 24 hours and have them retest and see why their blood pressure is going up. And so it kind of heads off visits to hospitals and doctors' offices if we can catch problems as they're developing. It's very well received, and the other advantages to it is we can share this information live with whoever they want to put into their circle of care. So their family physician, their pharmacist, even family members can look and see how their parents' blood pressure and vitals are. So it's quite a unique program, and enrollment in that program, like all of the rest of our program, is free. There's no cost to the individuals to be a part of that. Our community paramedics are also involved in point of care testing, where they go into somebody's home, they test their blood. Often they're testing it for their INR values, which is their blood viscosity. So when people are put on blood thinners, it's important that they get out to the lab, usually weekly or at least monthly, to have their blood viscosity checked to make sure that it's not too thin or too thick. We're able to do that test right in the home without them having to leave. This program will fund some other point of care testing that we'll be able to do in the home by just poking the finger and getting a small amount of blood. So that'll be another enhancement that will come with this funding. Another component of our program is we do Otn Virtual Visits. So we go into the home, we set up the equipment, and we coordinate a visit with a specialist so that that person doesn't have to make a trip to a large center to see a specialist. We bring that specialist right into their living room. We have specialized equipment that's a part of this, for instance, stethoscope, where when we place a stethoscope on the person's chest, the doctor at the other end can hear the breath sounds or hear the heart sounds. And so it's very unique, and we're able to deliver that service as well, again, to support people so that they can have these appointments and they don't have to leave their homes to have them. Influenza clinics is another big part of what we do in the fall, seasonal influenza vaccine for all of the people that are enrolled in our program, as well as public clinics. So that's a few of the things that make up our community paramedic program. As you can tell, we're pretty proud of the services that we provide. We think that this makes a big difference with the seniors living in Parry Sound District. And the people that provide these services are very proud of the care that they're providing. And we just, again, want to thank you for this funding, which is going to make such a difference in how we're going to be able to continue to provide those services. So back to you, Mr. Miller.
Thank you, Mr. May, and that was a great explanation. And thank you to all of our presenters for demonstrating how important this is to the whole area. And I also want to thank CAO Parry Sound Clayton Harris for his involvement in this as well. To the media that's on the call, if you have any questions you'd like to ask, there's lots of expertise that can answer the specific questions to do with this program. So perhaps if you have a question, if you can make yourself shown and wave at me, I'll recognize you then. Yes, Anne, would you like to ask a question or make a comment? Go ahead.
I do have a question. First of all, I think this is fantastic because we hear all the time about people wanting to age in place in their homes. On the other side of much of what council looks at is broadband. And I'm interested to know from Mr. May, how dependent you are on a robust internet connection in the rural areas, particularly for the remote monitoring and the OTN services, and what happens when that internet connection isn't there?
Thanks, and we'll get Mr. May to answer that question. And Anne, you've been a great advocate, and you're doing lots to advance the case of broadband around the region. So thank you for that.
Thank you, Anne, for the question. And that's a very good question because our remote monitoring does use internet to transfer the data. However, it's set up in such a way that when internet is not available, we're able to use cell service. And when cell service is not available, we're able to use a landline to transmit the data. All of the other services, landline and cell, tend to transmit data slower, and it's less dependable than what broadband Wi-Fi is. So that's our preference, and that's what the program defaults to, is to using the internet to transfer data.
So thank you, Mayor McDermott. Good point, and good reason to advance more broadband. I see Mayor Comrie on. I know we met down at Roma recently, and that was one of the issues brought up at Roma as well. Any questions from the media at all, or anyone else? Give it 30 seconds, but thank you all to all the health providers on the call today for the great work you're doing, especially through COVID times. You know, we're talking about support for our elderly, and I'm so proud of the fact that, and happy about the fact that there's been no fatalities in Parry Sound Muskoka in our long-term care homes, and really happy that that everyone is now vaccinated in the long-term care homes. And I look forward to more and more vaccines rolling out so we can all be vaccinated and get back to a somewhat normal life in the not too distant future. But
hold on a second. We had a question in the chat. Sarah Cook from the Parry Sound North Star has laryngitis. Now, if she wants to ask, I
have to go back.
Sorry, maybe she didn't have a question. That was just her comment.
Oh, okay.
No questions for me. Yeah, sorry, I didn't read it all before I interrupted.
No problem. Thanks, Leslie. And I'll just check the chat line again just to make sure that there's nothing else there. But otherwise, well, thank you very much, everyone. It's really exciting. And as I say, I'm really proud of Parry Sound and the great job all of you do for providing superior quality health care services in our area. So thank you. And I'm really pleased with this announcement today. So take care, and thanks for joining this afternoon. See everybody then. Take care.
Thank you.
Thank you.